Hello, my name is Kate. I'm going to be your nurse today. I'm going to be doing your CVC dressing change. Do you have any questions about that? No? Okay, great. I see you have your mask on. That's good. I'm going to go ahead and get my package open here. Get my hand sanitizer. And then I'm going to put my face mask on. And then I'm going to get some clean gloves on. And I'm going to make sure that my patient is in the supine position, and I'm going to make sure that the patient turns their head away from their point of insertion to prevent any contamination during the procedure. First, I'm going to start by removing the old dressing here, and we are going to work our way towards the point of insertion. And then normally we would remove the stat lock as well, but we don't have replacements, so I'm going to leave that on. And I would use a little piece of tape to secure the lines so that it doesn't pull out from the point of insertion. Alright, and I'm going to assess the site here for any signs of infection. There's no drainage, there is no discoloration, no redness, no swelling or heat, so everything looks good there. I'm going to go ahead now, remove these clean gloves, and I'm going to get the rest of my sterile site set up and get my sterile gloves on. And these are not sterile gloves anymore, but I'm going to treat them as such. And if they were sterile, obviously, I would be putting them on more appropriately. Okay, so first I'm going to get our ChlorPrep. I'll get that cracked. I'm going to go ahead and scrub the area using friction. And I'm gonna clean from outside or from the insertion point away from the insertion point. Friction. All right. Throw that out. I'm gonna use the alcohol swab here, and I'm going to clean the lines, working down towards the caps. Right, and next I am going to use the skin prep, which I had already used, so I'm going to pretend skin prep, and I would rub the border of where the dressing is going to go. And now I'm going to take my dressing and I'm going to make sure the point of insertion is right in the center of the dressing. And if it was one that had the antimicrobial patch in the center, I would make sure that the point of insertion was at the center of that. All right, and then I'm going to date and time. This dressing. I don't know the date. 24. Okay. And then we are going to go ahead and flush these caps as well. So with my prepared flushes, I'm going to make sure these lines are closed or open. Gonna remove these old caps. Attach my flush. I'm gonna flush these. And then I'm going to attach a clean green cap. And then the other one, make sure that one's opened up. And then same thing, we are going to flush that. And a new green cap. Okay, I'm going to document the dressing change, and that there's no signs of infection, that the flushes were done, date and time. Yeah, that is all I have.